Dr. Chena, good morning. Thank you very much for your time. How widespread is this problem where people seemingly are not collecting their medication currently for the other very important health conditions like HIV?
Hi, thanks so much for having me. Yes, we are very worried about this. We've seen these trends countrywide. In one of the districts that we're supporting, in Mpumalanga, we've seen that prior to coronavirus, the appointment take-up was over 80%. But now, since the coronavirus crisis has hit us, people are missing up to 60% of their appointments. So only 40% of appointments are being kept, which is very worrying, especially for our HIV positive patients and all patients with chronic illnesses. This is a time where it's really important for them to be taking their chronic medication.
So it's the appointments that are needed clinically, obviously, but when they go for appointments, they'll be collecting their chronic medication. Is it because of the lockdown?
Yes, we think that it's a combination of factors, but really probably one of fear, of people being too scared to take public transport, to go to the clinics, scared of possibly getting coronavirus, which we completely understand. And in that way, we are glad that at least that message has got to come across, that, people should reduce their use of public transport and going to the clinics unnecessarily. However, fetching your chronic medication that you need to take every day is not an unnecessary trip to the clinic. That is an absolutely vital trip to the clinic.
Yeah, especially because if you have that kind of a serious health condition, like if you're HIV positive or you have another serious chronic condition, you need to be able to continue taking the medication because you are more vulnerable to COVID-19 from what we've been told by health experts.
Absolutely. The highest death rate that we've seen in coronavirus is always with people with comorbidities, people with high blood pressure, diabetes, kidney disease, heart disease, lung disease. And we are worried in South Africa that HIV might be one as well.
How do we get the message across? I mean, how can we be effective? On the one hand, we are saying stay home, be safe, practice social distancing, and the country as a whole, the world as a whole, is focusing on COVID-19. How do we get the message across to those people who need to go and get their chronic medication?
So I think we're just trying to explain that we are all going to be at risk of coronavirus. And if you are going to get coronavirus, you need to make sure that your body is as healthy as it possibly can be. So whatever comorbidity you have, whatever other illness you have, it's really important that you are taking your medication. And then we're trying to make it easier for patients so that they don't have to travel long distances, go and stand in queues at the clinic. We've restructured the clinics so that people can come in and they are screened for coronavirus. If they have symptoms, they don't go to that normal waiting area. They are isolated and protected and given masks. So we on the general guidelines, everyone traveling in public transport and going to clinics should wear a cloth mask, a fabric mask, and they must always try to stay at least 1.5 to 2 meters away from people, wash their hands regularly, take all those necessary precautions. But then we're also trying to make it easier in other ways, such as using external pickup points for chronic medication. If you've been on your medicine for many years or even months, but you are stable, you don't have to go to the clinic to collect it. There are external places you can go. So the government has a program called CCMDD, which allows patients to go to their local Clicks or Dis-Chem or Pick n Pay or even their local spaza shop to collect their medication. So we really encourage people make use of that. And then Right to Care has also developed 2 platforms that can be used. The one is our PDUs, which are like an ATM machine that people can go and collect their medication from this ATM machine. They get an electronic transfer with a pharmacist to check that their script is okay, and their medicine will pop out like a vending machine. And those are accessible in Soweto, Diepsloot, Alexandra, and in Bloemfontein. And then a new thing that we've developed is electronic lockers called Collect and Go. And those we're going to be rolling out 70 lockers in different places in Mpumalanga, Free State, and Gauteng. So we encourage people to look that up and register for that. and then they can collect their medication without having to travel long distances and stand in long queues at the clinics.
Well done, Dr. Julia Turner, to you and Right to Care in trying to help, because indeed it is very important for anybody who's got HIV, who's HIV positive, has a serious underlying chronic condition, to continue to collect their chronic medication. And you guys have created all these wonderful platforms to try and help.